Hello and welcome. Thank you for joining us today. The Global Alliance is pleased to be hosting this two-part webinar series on COVID-19 and immigrant and refugee communities, challenges and responses. At the bottom of your screen, there's a question and answer box as well as a chat box. We will answer as many questions as possible at the conclusion of all of our panelists' presentations. I would like to introduce you to our moderator for today, Arelis Moore de Peralta, who will also be sharing an overview of the session. Arelis has many titles, including a member of our Migrants and Displaced Person Task Force, as well as one of the Global Alliance's Board of Directors. Arelis, welcome and thank you.
Thank you so much. Welcome everybody and good afternoon. Thanks so much for joining us this afternoon. And we are going to be sharing about the challenges faced by Latinx immigrants during the COVID-19 pandemic. This is of a two-part series webinar. For billions of people, normal, meaning life before COVID-19, was not working. The pandemic is amplifying inequalities and having dramatic effects on social determinants of health. The direct health effects of COVID-19 differ by race, gender, wealth, and comorbidity. Yes, COVID-19 is a human catastrophe, but it gives the health community an opportunity to rethink, redefine, and innovate. Our three guest speakers will be sharing their how-to with us today. Next, please. Latinx families have been severely hit by the pandemic. The situation has deepened existing social, economic, and health disparities. At the same time, the services to support Latinx families in need have been interrupted by policies to control the spread of the virus, such as the stay-at-home orders. Our guest speakers will share with you about what they are doing to confront this dire situation, including their response to the challenges and needs of immigrants, their experiences of working with them, best practices and strategies for advocating for and mediating on behalf of immigrant communities, and their adaptations to service delivery to reach clients and to maintain engagement in programs and services. Next, please. Now, I want to share with you definitions of two key terms that we will be using consistently throughout this webinar. Immigrants, as per the Migration Policy Institute definition, are people residing in the U.S. who were not U.S. citizens at birth, including naturalized U.S. citizens, lawful permanent residents, refugees and asylees, certain legal non-immigrants, and persons residing in the country without authorization. Hispanic Latino, as per the U.S. Census, is a person of Cuban, Mexican, Puerto Rican, South or Central American, or other Hispanic culture or origin, regardless of race. Latinx is a person of Latin American or origin or descent. This term is used as a gender-neutral or non-binary alternative to Latino or Latina. COVID-19 is definitely a complex emergency. By July 2020, there are almost 4 million COVID-19 cases reported in the US, and the disease has taken more than 140,000 lives. The complexity of the COVID-19 pandemic relates to its intersectionality with several other inequities and issues which have historically affected communities of colors in the US and globally. The Latinx population makes up a disproportionate share of COVID-19 related deaths in the United States. As you can see in this figure, Latinx individuals are dying in greater amounts as compared to white non-Hispanics in most US states. Evidence tells us that the Latinx population have experienced 17% of COVID-19 deaths but represent 18% of the US population. In the figure on the left, you can see that the Latinx population age-adjusted COVID-19 mortality rate is 2.5 times as high than white Americans. In the figure on the right, when we disaggregate this data by states, using as an example the District of Columbia, especially New York, has seen the greatest absolute disparities in COVID-19 mortality rate between Latinx residents and their white counterparts. Here I'm presenting selected challenges faced by Latinx immigrants according to a Migration Policy Institute categorization. Immigrants in the US are on the front lines as nurses, as doctors, first responders to the COVID-19 pandemic, and yet are disproportionately affected by the virus and with reduced health care. In terms of the economic challenges, immigrants make up a big share of essential workers in the fight against the pandemic, even in food and domestic household occupations, sectors which have been severely hit by the pandemic. Immigrants have been blocked from federal economic relief. The Banking National Research Center on Hispanic and Latino families informed that about 60% of Latinx and Black low-income families had limited or no access to banks. Also, this situation is impacting our countries of origin, as global remittances have failed about 20% this year. In terms of access to healthcare, Latinos have the highest uninsured rate among any racial or ethnic group within the US. We can sum to that the lack of culturally and linguistically relevant healthcare services. Lack of health insurance also impacts access to mental health care services. In terms of the mental health challenges, COVID-19 challenges for immigrants include isolation and uncertainty for the future. Disruption of the educational system is exposing parents and their children to new types of relationships, but also new types of stressors. To make this situation more challenging, we have seen as racism and xenophobia are on the rise in the United States. A little more on economic challenges. The unemployment in the US is most pronounced on certain demographic groups, including immigrant women, and regardless whether they were born in or outside the US, Latinx and workers with less than a high school degree or under age 25 are more impacted by unemployment. In the figure, you can observe how after January this year, Latinx became the race ethnic group with the higher unemployment rate. In a high unemployment scenario of 25% unemployment, 10.8 million non-citizens would be uninsured. Regarding mental health challenges, before the COVID-19 pandemic, SAMHSA found that out of the 18% Latinx who represent the US population, 16% reported having a mental illness in the past year. Yes, that represents over 10 million people. They also found that between the period 2008 to 2018, overall mental health issues are on the rise for Latinx people. Serious mental illness rose from 4 to 6%. Major depressive episodes increased from 13 to 15%. Suicidal thoughts, plans, and attempts are also rising among young adults. Binge drinking, smoking, illicit drug use, and prescription pain reliever misuse are more frequent among Latinx adults with mental illnesses. Social isolation and other restrictions imposed by the pandemic can only worsen this situation. And now, without further ado, in this introduction, I would like to introduce our first guest speaker, Debra Alvarado from the Hispanic Alliance, and she is the Operations and Network Manager for this organization. Welcome, Debra.
Thank you so much, Arelis. It's a pleasure for me being part today of this discussion, and I look forward to learning as well from my colleagues today, as don't know some of you guys. Hispanic Alliance is located in Greenville, South Carolina, and we are a nonprofit organization that fosters collaboration and connectivity among people, resources, and cultures to build thriving communities. We unite the largest network of agencies and individuals working together to advance our community here in the upstate region of South Carolina. And we have over 3,400 members strong working together for our Hispanic community. Our main goal is always to build trust with our community by speaking the language, promoting the culture, and understanding and addressing the needs that we have. We know, as Arelis mentioned, before this pandemic started, we had many issues that we were targeting that now are coming into life, unfortunately, and that is what we're working on at the moment. For our organization and with our partners, serving the community is primarily our number one goal is to make sure that everybody has trust. Again, we promote cultural, linguistic, and socially in an appropriate way. And to do so, we have 4 community teams that our organization primarily focus on to promote events, programming for our community members. This word community member is something that you guys are going to hear me talk about very often, because this is how we refer to our community members. We want to make sure that they're feeling part of the community. We don't want to put labels on anyone, and it's something that everyone feels very welcome and safe to do so when they're coming into the safe space that we have created for them. The 4 areas that our organization focuses on is health, financial stability, education, and legal access. I'm going to talk a little bit about the health, which you will also hear from Ruth Rivera in a second. She's the chair of our health team. Our 4 teams throughout the year work on programming to serve the Hispanic community in our area. We focus on providing programs that 1 is free, 2 is educational, 3 open doors for our community, and understands for the families to learn how to advocate for them, for others, and open doors for their families. Throughout the year before COVID, we have programming involving health fairs, healthy cooking classes, entrepreneur series, personal finance workshops, citizenship workshop, lunch and learn, know your right presentations, and many others. With COVID on the rise, we had to shift and adapt, which I will talk to you guys in just a second. But I wanted to give you guys an overview of what organization works on, which is serving the Hispanic community here in Greenville, South Carolina. Just to give you guys a number, in our area in Greenville, South Carolina, we have 44,000 Hispanics, and we know that we are in the census year, so this number will definitely change, and we'll get to have a new number hopefully next year when the data is revealed. But we know that the date keeps getting pushed because of COVID-19, so we won't put a label on that date. But as of right now, we have about 44,000 Hispanics living in the area, and that means that we comprise 9% of the Hispanic community in Greenville County. Hispanic Alliance is a primary organization here that connects individuals with agencies providing resources in our area. So we are that bridge of communication between a community member needing and looking for a resource and that agency that is providing that. We want to make sure that when we are referring someone to an agency, we educate the agency on the need, also on the barriers, whether that is a language barrier, financial, immigration status, and also wanting them to understand that we need to build a safe space for our community members. One thing that is very important, and we see it now more than ever, is the question about status, right? So we have a lot of community members calling what It started just as a request for assistance form, and now people are calling it the hotline, a phone number that we have for our community members to call if they're needing a resource. And one of the questions that we get all the time is, if I'm calling this organization because I need to get a COVID testing or because I need to pay my rent and you're telling me that they have a service, are they going to ask me for Social Security? Are they going to be asking me about my home address? Because if that's the case, I'd rather sleep in my car with my kids. I don't want to have that information given out. And the answer is no, we don't do that. And we educate our partners in some of these barriers, because we want to make sure that after this is over, after we are in a better place, these agencies continue to provide these services to our families, and remember that they're part of our community, which again, this is why I always refer to everyone that come into our office as community members. Through COVID, we had to shift and adapt. So I mentioned that before, we had events in our community. They were well attended, over 300 people. And of course, we cannot do that anymore. There is a need. But how do we do that? So we have done several new things. One, we have to educate our families, but also we have to educate the partners that we work with. So I will give you an example. If the school county is providing information about what e-learning is and virtual platforms and whatnot, ensuring for them to put information out there that is in Spanish. We know that a lot of our families don't have access to internet. We know that some families might have a very small plan of gigabytes available to connect to a Zoom meeting that, it will consume their data in just a matter of 2-3 hours. So what do we do in order to continue to provide information, but keeping in mind that, if we do a virtual Zoom meeting, some of our parents are not going to be able to use that phone for the rest of the month. Does that mean that we transition into social media? Because a lot of them are using social media. Nowadays, we're spending more time on our phones, we're more on Facebook. That doesn't consume that much data. So finding different avenues, not only for Hispanic Alliance, but with the partners that we work with, to be able to continue to provide information. When COVID started, one of the very first things that we did was reinvent our entire website to be able to offer resources for our agencies and for our community. And if you go to our page, which I'll make sure to link below in the chat after this, if you go to the English website, you will find the information that is tailored for agencies. And also, if you go to the Spanish website, you will find the same information in Spanish so that the agency can determine which resource they're referring to the family, and the family being able to find that exact link and that exact resource on our Spanish website. So that was the very first thing that we did. Then we transitioned our phone line, a request for assistance phone line, into what is now called by community members the hotline. And people call us all day long. They send a text message because they know that when we pick up the phone, we are going to be answering in Spanish. They know that we are family here, and they know that we are going to be helping them with the resource that they're looking for. If you ask back in March and April, the main questions that we received were about food scarcity and about community testing sites. Food scarcity is something that just hit home for a lot of us here in our community. We know that we have a lot of food banks in the area that are providing resources, but then something very interesting is that same community members are calling us back because they don't know how to cook with some of the ingredients provided. The main question we got were, what do I do with this? And they're referring to this to peanut butter. What do I cook with peanut butter? What do I do with it? And that's just one of examples. So with Hispanic Alliance, and we partner with Pasos, which Rivera will talk more about Pasos later, we started a program called Canasta Básica, which is a basket with ingredients that are culturally appropriate for our Latinx families that they know and they enjoy to eat at home. Of course, we're always taking a health approach, so we made sure to include ingredients that everyone in the family could eat, that they know how to cook, that are fulfilling to them, but also making sure that we're providing food that making sure that a diabetes person, someone with diabetes could enjoy, someone that has underlying conditions could as well. We started doing 3 runs once a week, partnering with local stores, Hispanic grocery stores, because we also want to make sure that they're staying afloat. We know that our local businesses are hurting at the moment. So we partner with local stores to provide these food baskets. And after 3 runs, as a small organization, everybody is hurting, and we wanted to make sure that we had the funding available. Phone calls kept coming. And not only we started seeing more Hispanic families come in, but we also started seeing more Caucasians and African Americans, because they really enjoy the ingredients that they were receiving in these food baskets. As I speak at the moment, our team is at a local grocery stores handling 100 food baskets today. Something very unique that we did was also providing them a gift certificate to go into the store for many reasons. One, because we want our families to still have that power of going into a grocery store and buying the ingredients that they like. We all have different backgrounds. We all like different ingredients, different things to cook. And if we're not able to provide that in a food basket, we want to make sure that we give them that power of going into the store and buying those. Something also very important is that when they're coming in with their children, having their children see their parents doing something that they consider normal before March was very important to us. So a lot of the kids were, why is mom asking for a food box, going through a line, sitting in the car for 30 minutes versus going into the store like I'm normally, used to seeing her do. So having the kids going into the store again with their mom and picking out their favorite, cereal, or going into the meat section and finally having that was something very important. And we saw a lot of, smiley faces. Thankfully, we're able to continue to do this at least for another couple of months. And we have a wait list already of over 200 people that are wanting to participate in this program. So I think that has been the biggest difference in adaptation for our organization. We have always been grassroots, but again, we have 4 areas in food scarcity to us fell under the health team. Other things that we are going to do now is shift some of our programming into a virtual platform using Facebook Live. So our financial stability team is going to be working starting in August in different workshops on how to save during an emergency, home purchasing, estate planning, because unfortunately we have a lot of families that don't have information about power of attorneys and wills. And, we know that we have families that have severe, suffer from someone passing away in their family. So having all of this information is important. We will continue to have our DACA workshops and Know Your Rights presentation, because this is a prime time also for our legal team, and we will continue to have more programmings available. I want to be respectful of time, and I know that I only have 1 more minute, but I just wanted to say that if you visit our website, you can find more information there. 2 years ago, we conducted a community needs assessment to better understand the needs of our community here in Greenville County, which has a lot of data pertaining more to the health team. But if you want to find out more, please visit our website. I will also leave my information below in case that anybody wants to connect. And again, thank you so much for the opportunity.
Thanks so much to you, Deborah, for such relevant information you share with us and the great work you've been doing. Now we are going to have with us Ruth Rivera, who is the program manager for the Pasos Greenville chapter. And welcome, Ruth.
Thank you. Thank you. I'm so happy to be here with everyone. And so my name is Ruth Rivera, and I am the manager for the Pasos program here in Greenville County. Pasos is a community-based organization that provides culturally responsive education for our families around health, early childhood education, positive parenting skills, individual guidance for participants in need of resources, and partnership with healthcare and social services providers to help provide a more effective service for our Latinx population. Pasos has been, this year we turned 15 15 years old. We've been on since 2005. And it started with the initiative of educating our Hispanic women, especially our pregnant women, around the education on prenatal care and prenatal vitamins. Folic acid specifically, because back in '05, there were unfortunately, a lot of Hispanic women that were having babies with birth defects. And so the former executive director decided to do some research and education around folic acid. And of course, back in 2005, South Carolina was one of the states that was growing rapidly with our Hispanic population. And so it grew to not only helping our pregnant women, but then it grew to helping the whole family in general. In Greenville County, we've been here since 2009, and we've been under what now is Prisma Health, back is Greenville Health System. And so our work here in Greenville, we're embedded with the health system. Out of the 8 sites in South Carolina, which we are only in South Carolina, hoping to spread to other states, we are in 8 different sites. And here in Greenville, South Carolina, we're the only site that is embedded with the health system. We're working with the other sites so that they can connect with other health systems, just because of all the great benefits that it's been doing for our families. Our mission is to help build a stronger South Carolina by supporting our Latinx communities with education, with advocacy, and with leadership development. Also, our vision is to help and to have as many healthy Latino families or Latinx families, communities that can contribute to a stronger South Carolina. With the work that we do here in Greenville, we are 3 staff. So it's myself, and then I have Guillermo Martinez and Sebastián Villasís, who are our resource specialists. We are embedded with the Center for Pediatric Medicines, which are our 2 pediatric clinics where the majority of our Hispanic families attend. And what we do is we help our families, our moms, connect with their children with Medicaid, WIC, and SNAP. All of our work is in Spanish, and that really helps with build the trust that we have built for the last 10 years. Biggest thing, if you don't remember anything that I say today, is I can never say it enough, is how important it is for us as organizations to gain the trust of our individuals or of our Hispanic families. We know that our families go through so much just to be here, that the trust is very important. The moment that we do that, then our families are more willing to do things and to get a primary care doctor and to follow the rules right now with the pandemic. I mean, it just really has helped a lot, just the trust that we have developed for the last 10 years here in Greenville. One of the things that we have done, just like Deborah was saying, we used to do a lot of health fairs and a lot of things directly with our community. But because when we started having to have social distancing, we had to think outside the box and think of other ideas and other things that we could do to approach our families. One of the things that, just like Deborah said, we are doing is a lot of social media, Facebook Lives. I normally don't like the flies or anything like that, and I have become more used to it, and it really works. We are seeing an increase not only in the amount of individuals that are getting tested, but then also on the education side. We're getting a lot of feedback from our families. A lot of phone calls are coming in just from that social media, FaceTime, Zoom meetings that we're having with our community. So going virtual has really been a challenge, but it really has been amazing as well, just to how it's been working so great. Now, of course, here in our area, 44,000 of our individuals are Hispanic. That's 9% of the population. And unfortunately, a high number of our population has been hit with COVID. Because of the community testings that Prisma Health is doing and the partnership with PASOS, it really has helped for our community to get tested. And of course, the numbers have shown that way. For example, just to give you a little bit of an idea of how things are going here in our area, starting in mid-March and April, 4.9% of our patients that were tested identified as Hispanic. Then around May, we went up to 17.5%. And then because of the work that we've been doing with the community-based testing, it indicated that the prevalence of the virus was significantly higher in our Latinx population throughout the testing. And so March, April, positive tested, we had people that identified as Hispanic and had a positive test. We're talking about 10%. And in May, we went up to 42.4%. So a lot of different things had to do with it. Of course, more testing, but also a lot of our families are in the front lines of many, many works, many jobs. And that also had a lot to do with our community, unfortunately, being infected with the COVID. We, as PASOS here in Greenville, because we work directly with Prisma Health, have had an opportunity to be able to connect directly with our families. And we've been able to help nurses and doctors and case managers and social workers and palliative care departments to help navigate how to properly work with our Latinx community and how to talk about death and how to talk about just those serious conversations that are different between cultures. And so we've been able to do that. And that's something that has definitely shifted from our previous work, which was more on that preventive connections, connecting our families with a primary care physician and making sure that children have their Medicaid filled out and WIC and SNAP and all the resources. So a lot of our work has shifted more to education around COVID, and it has also shifted on that part of educating staff on how to properly talk about death and how to talk about different things with our community. So it's been definitely interesting shift, but we have really just adapted to what's going on and to the new normal of work and social distancing and wearing a mask. So one of the other things that PASOS does is something that I mentioned, which is our leadership. We have a team of community health workers and volunteers that really help us with our work. They are trained to go out to the community and talk about what PASOS does and the services that we provide. And it really has helped a lot right now with all the education that we have been able to give about COVID and how to maintain social distancing and hand washing. So it's been really good. And I know my time is up, so I want to respect that. My work with Hispanic Alliance has also been great and making sure that we provide food for our families that is culturally appropriate. So we do a lot of work with our Latinx community. The biggest thing that we do is advocacy. So we love that. And we love the work that we do with PASOS. So I know my time is up, so I will give it back to Arelis.
Thanks so much, Ruth, for sharing with us about all the great work you've been doing at PASOS and also in collaboration with the Hispanic Alliance. And now we are going to be introducing our colleague, Banu Valladares. And Banu is the Executive Director of the Charlotte Bilingual School. And she will be sharing with us about the great work they are doing. Banu, welcome to the webinar.
Thank you. So at Charlotte Bilingual Preschool, we prepare Spanish-speaking children for success in school and life by providing them with a superior dual language education. And our focus is economically marginalized families in Mecklenburg County and families with children 0 to 5. That was the next slide. Thank you. And I have to figure out how to cue this. That was that one, the cute one. Next. So why is early education so important? Recently, Charlotte ranked 50 out of 50 cities in the United States for economic mobility. That means that if you're born in Charlotte or live in Charlotte in poverty, you're 4.5% likely to get out of poverty. And they identified lack of access to early childhood education as one of the key factors. Next, please. So without access to a high quality preschool education, our children enter kindergarten a year behind, are half as likely to read proficiently in 3rd grade, and are 4 times as likely to drop out of high school. Next. So last year, only 41% of Hispanic 3rd graders were reading proficiently compared to 82% of their white peer. And many of these children, as you know, live in poverty and face additional challenges like limited language proficiency and cultural isolation. So we provide a unique solution that is a 2-generation approach where we serve the needs of both the children and their families. We are the only 5-star licensed dual language preschool in the state. And we have several programs. Our preschool program serves children 3 to 5 in a 10-month program that follows the public school calendar. The Green Room invites English-speaking children to learn alongside our Spanish-speaking children to promote language and cultural and social exchange, cultural and social capital exchange. And then our family programs are designed so that we involve our families as partners in their children's education. So that includes cafes, workshops, English as a second language classes, and community building opportunities. Creciendo Juntos is a 10-week workshop that we provide for young families and their babies and toddlers to learn through play together. And then our Parent Child Plus program, it's a home visiting program that supports the transition to pre-K and connects our families through resources. In addition, we provide wraparound services. We work with several community partners to provide occupational and speech therapy, and then also family counseling. So nearly, as we look at the community in the context of COVID, about 15% of our community in Charlotte identifies as Latinx, and that number continues to climb. And we know that new immigrants to the region encounter numerous obstacles to success, particularly with their children in school. And like you saw in the former slide, about now 27% of our children in the public school systems are Latinx. So COVID has really taken a toll on the community at the national level. As you know, half of our people, Latinx families, have lost their jobs. 74% of them do not have health insurance or access to local federal support, and fear retaliation accessing services. So they are also not having those accesses, but also the system is not created in a way to look at the complexities of being an immigrant in the United States. So we know that a recent study that was released is showing that the impact of COVID in children's reading skills, it's going to put them behind 7 months. And if that child is Latinx and living in poverty, that number looks bleaker. So we have done a number of things to figure out how we're going to respond to the impacts of the pandemic to our families, including the social health and economic impacts that it's had. So employment, housing, food, access to community. Our focus has been on delivering our mission, making sure that our children and families have access to high quality programs, then supporting our children and families' needs through these difficult times with resources, basic needs, financial stability, and then our commitment to the financial stability of our team. So we have been able to keep everyone employed. So this remote learning, we quickly had to redesign and move all of our programs and operations to remote. And that meant using the technology that our families have access to, which is phones, and the use of apps like WhatsApp, and then good old phone calls, video calls. We have also had to adapt to meeting the challenges of both the children and their families that we serve, but also the families that our teachers are serving at home. We created a referral system so that when the teachers were connecting with the families to deliver remote learning, they could then refer services to our family programs so that we could figure out what their additional needs would be. And within all of this, we still were able to promote substantial improvement in our children's social emotional functioning, early literacy, early language skills, all of that in spite of interrupted learning. So then we moved to figuring out how we support our families' needs. We designed with, so we surveyed our families and contacted them, and they identified food as a basic, one of the biggest needs, then cleaning supplies, baby food, and information. So we shifted our culturally appropriate preschool food program to create a family food program, working with Manolo's Bakery. And we found a donation, an anonymous donation that was able to give us that opportunity to do that. World Central Kitchen then came into town and helped us meet the additional need. The food program includes 2 prepared meals plus perishables. And we're currently serving 88 families, but starting today, we're gonna have to drop 54 of them because of lack of access to funds. And the other 34 will be able to serve for another 3 weeks. So one of our approaches was to really shift our communications to reflect the impact of the pandemic on our families. I think people were trying to figure out how not to fund education, and we had to say, listen, it's beyond education. This is now, we're now looking at families don't have food. So we were able to leverage funding from Hispanic Federation, Women's Impact Fund, and United Way COVID Relief Fund to then provide essential pandemic food items, bags of arts and craft for the families, computers, and then engage the community in distribution of this, created a list of healthcare options and resources for our families. And now we're working on bridging the literacy, the digital literacy gap with our families, providing workshops on how to use technology, and doing a pretty robust summer bridge program, where we have 63 families that and their children participating to narrow that 7 months plus gap in their reading skills. Next. So, oh goodness, I kind of, they showed you saw all of that. Thank you. I skipped that slide. So, it has been pretty obvious that the system is not built to support the people that we serve. The number of children in the public school systems in Charlotte that identify as Latinos entering kindergarten is 3,000. So we desperately need more support for dual language education. We need to be able to prepare children that can continue to have consistency and growth through the second grade in ways that we have provided. So basically what we're thinking that we need to do is just continue to lean into our mission to provide more dual language education for children. We've created and approved a very aggressive strategic plan that would get us to serve 1,500 children. And then, and part of that strategic plan is dismantling a system and creating a new one that actually corrects the inequities that the system is now providing for our children. So that's my story. Thank you.
Thanks so much to you, Banu, for walking us through the wonderful program that you are leading, and also all the adaptations you've done to continue serving your families. It's been great to learn about it. Right now, I'm going to make a very quick summary, kind of wrap up of our 3 great presenters, which I tried to do justice to the great information you shared, but it's gonna be very succinct so we can move on to the question and answer section. One of the things that I appreciated from our three presenters was the deep emphasis on making sure the services you deliver are culturally and linguistically relevant to the families that you serve. To me, that's key. And how you make that a transversal element that goes across all the different actions and programs that you deliver to your families. The next aspect that also caught my attention, and I also want to commend you for, is the focus on building trust with the families that you serve. We know, as a Latina, that I am myself, how important is to develop that trust, confianza, that rapport with the organizations we interact with. Also, it was very important to notice that you developed strategies to address the fear and historical mistrust our families have in the institutions where they would be able to go and look for assistance and services to fulfill their needs. I saw that there are a lot of, I saw commonalities among the different needs each one of the three organizations identify in their families in the time of the pandemic. Food seems to be a common need in addition to information. So it's not just, it's both nourishment of course, of the body, but also of the mind, to be able to protect themselves and their families. And to me, that speaks highly of how much importance we Latinos give to our families and their health and well-being. That was a key commonality I noticed. Also, the creative use of social media platforms to continue to engage your families with the organization, how you were able to very creatively use all the different Facebook and WhatsApp and the different media outlets that you mentioned, which are more accessible for most of the families that you work with. Another common element I saw across your three efforts is the focus you are making in developing alliances and partnerships with other organizations and businesses. We might have the same interest that your organizations have in strengthening and supporting Latinx families during these uncertain times, and to be able to serve their needs. There is a lot of good things that you mentioned. I also value the focus on the family as a unit, importance of the child, nourishing the child, the education, and maintaining that education in the best quality possible to try to avoid increasing the gap that already exists, and try to continue making efforts to break that intergenerational poverty that it's been affecting our Latinx communities for so long. So I could continue mentioning strength in the wonderful work that you do, but in the sake of time, and to make sure we have at least 10 minutes for Q&A, I'm going to stop here. Thank you so much, and congratulations for your great presentations and for sharing those experiences and adaptations with us. And now we open formally the Q&A section. And let me see, I'm gonna be looking at one of the questions. If anybody is interested in joining the Global Alliance, our organization, you are more than welcome. We are passionate about fostering policies and programs that address and promote social justice and behavioral health. In particular, our communities of colors welcome, and we'll be pleased to have you in our organization. There is a question for Ruth Rivera. What would be an example of how you would educate staff on how to properly talk about death or other sensitive topics with Hispanics, Latinx patients?
So that is a very good question. Thank you for asking that. One of the biggest things that, again, like I mentioned, is gaining the trust, not only with our Hispanic population, but also with the staff that you work with the hospital, with whoever you work with. You have to gain that trust and that relationship build. You have to build a relationship so that when you start talking about things that are different for someone else, the way that they perceive it and receive it is way different than if you just walk in and tell, let me tell you about how we think about death, and so that relationship building really helps a lot. For example, one of the things that if you've ever been hospitalized for whatever reason, you've probably been asked, would you like for us to call a priest to come see you, or a chaplain? And for our culture, if you're calling a priest or a chaplain or a pastor, that means that you're going to die, basically. And so educating our nurses and our doctors to be sensitive when it comes to that, and say, hey, we ask this question to everyone. It doesn't mean anything. We just want to make sure that if you like to speak with a priest or a chaplain, that we have it available. Will you like that? So adding that extra step and the sensibility part really helps, because it just brings that it's okay. You're not going to die. It's just a service that the hospital provides. So that's just an example of the things that we have worked with the health system to educate our nurses on that specific point. We do a lot of education prior to. We meet with nurses teams with different floors and different departments. We do a lot of cultural sensitivity education. So that's one of the things that.
Thank you so much, Ruth. And there is a question to all panelists. It says, without being able to sit face to face with people, how can we effectively show them how to utilize social media in order to share information, host workshops, etc.? Not all of our clientele has internet access, Zoom, or know how to use their phones for anything else other than calling people and maybe looking at YouTube videos. So, any of the panelists?
I am happy to answer that. We in our digital literacy workshops, we do use the technology that they do have, which is the phone. And so we sometimes use video, or again, WhatsApp. All of our families have WhatsApp to communicate back at home with people. And we can do a video in that moment and show them, really, here's how you click, this is what you do. We have had to become very nimble and responsive in how we, provide remote learning to families. But we find that our families are responding really well to that. And what's been fun about the pandemic, which is, it's that it's been able to create deeper relationships between our teachers and our families, where you typically have the gap of the teacher is the one that knows everything and the family doesn't, or, culturally. Where there's now this deeper understanding of families, and the families understanding that sometimes they also do have plenty to share, right? Because they are the main caregiver back at home. So yeah, that's what we're finding, that it's easy to share through WhatsApp.
Something also that has worked for us is, at the beginning we created a handout, 5x7, so like the size of a frame, and it included a QR code where people could just use their phone and tap, and it had some information as to how to access our Facebook page, how to access our website, everything in Spanish. And then on the other side, it had all of the information that they will be able to find on social media in case that they didn't have access to internet. So maybe creating a handout, for example, for us, we put it on our canasta básicas. We also went to the grocery stores and asked them if they could put them in their bags. We also asked some partners that had their door opens for services if they could go ahead and hand out. And it worked for us, because then we had something to give to a person that they could go home, read it, have a step-by-step, and already had a QR code so that when they had access to internet, it would take them directly to our page. So another approach as well.
Ruth, is there anything you would like to add to that point, or should we?
Yeah, for us, because of the amount of individuals that we've been helping, because our numbers went up. March started with everything. We started doing community testing, and our numbers went up. It's been very challenging. Facebook really has helped us to convey a lot of the education and information that we have given. But when it comes to like, for example, how to fill out a Medicaid application, we're literally calling people on WhatsApp or FaceTime, and we help them, and they show us, and we help them. Okay, right there, you write your name and write. And I know it takes a lot of time, but the need is there, and we got to do it. So I know that our way of doing it is probably very ancient, but it's helping at the moment for that. But when it comes to social media, we definitely are working on those.
Thank you so much, Ruth. We have another question. It's to all panelists again. How has financial instability and economic struggles associated with COVID-19 affected your organization's funding? What plans do you have to adapt to financial struggles your organization and community will continue to face as the pandemic continues?
I can have a happy story. I think part of what we did was we pivoted messaging quickly to really be able to tell the story, because what we saw was that funding was really looking at supporting basic needs, and we had to say, actually, our families don't have food. That is a pretty basic need. So we, even though we could not host our fundraiser that typically provides a good chunk of our money, we were able to receive COVID relief funds that set us up in a pretty good place. You know, we continued to keep an eye on budget and all that. We've also secured several government contracts, so we've got a pretty balanced financial picture for us. So we're staying strong. But our donors, we've leaned in on our donors, and we just kept a lot of communication. Really, without that, I think we would have lost funding. But we just kept telling the story. Here's the story. These are the numbers. This is how it's impacting, and we were able to decrease the impact that way.
Thank you. We have 1 more minute. I don't know if either you, Debra, or Ruth, would like to share how are you dealing with this financial instability situation?
Yeah, so for us, our main goal was we wanted to keep the whole staff together and not fear of furloughing, and knowing that everybody will have job stability at least through 2020 until we figure 2021. That is one of the reasons why we took the approach of canceling some of the programming, even if they were not in person, and also our gala, which is, is coming up, La Fiesta, and that is the fundraiser, event of the year. So for now, we have focused on keeping the staff contact, because it's important now more than ever. Our community needs us. So we have shifted. Again, messaging is something that we have shifted, but also having that constant communication with our donors and our supporters. So we have been able to also secure some new grants due to the work that we have been doing with COVID. So luckily, we are in a good position for the rest of the year. And now we are thinking about 2021 and how that could look like.
Thank you so much, Debra, Ruth, and Banu. We are out of time. Time flies. Thank you so much for the participants for the great question. And if you are enjoying today's webinar, stay tuned for the part 2 of this webinar series, where we are going to be in August 20th, same time, sharing about strategies to assist refugees and detainees in the US, and we have great presenters, so we hope to see you all back here that day. So, and there will be a follow-up email sent by the Kirby to participants with a short survey, and please kindly complete that survey so we can continue to improve this type of events. Thank you so much. And with this, back to you, Gira, to say the final goodbye.
Yes, well, thank you everybody for joining us and asking the great questions. And panelists, thank you so much for this wonderful webinar. We look forward to part 2 webinar, and everyone will be receiving an email that does have the survey as Aurelia suggests, but it also has the link that will be posted for you to watch the video again of the webinar, and obviously you'll then be able to see the slides. I understand there was a question specific to the slides, so you can listen to that explanation again. And there will also be information in the coming weeks about the second webinar as well. I just want to give another reminder that's in the chat box that we do have our upcoming conference, Coming Together for Action. You will see the links to that as well. Registration will open soon. We have a lot of amazing content and keynote speakers, and I'm very excited to say that Aurelis will also be presenting on another topic in the conference, so you might be interested in that. Again, thank you everyone so much for your time, and even more so, thank you for all of your work in the community. You are making a huge impact on so many people, and we appreciate it, and thank you for sharing and allowing us to learn with you. Thank you very much. Goodbye.